Hey everyone, it's Era here, and I want to talk about pain and massage, pain management specifically with massage, and using massage therapy as part of your medical care plan to manage your pain, either acute pain resulting from injury or chronic pain resulting from old injuries or chronic illness. Okay, so what I want to say up front is that massage therapy may have been something that you have tried. And if that's the case, cool. If it's helped you in any way for your pain, I certainly want to know in the comments and why specifically what was that was done within your care plan that made that a possibility. If you've tried massage therapy and it has not helped you in any way with your chronic pain, I also want to know why. So a couple of things that I want to make sure that we go over during our brief time here today is massage versus opioids and massage as long-term care for managing pain. So let's get into the opioids real quick. So opioid medications are usually controlled substances. You may know them as like Vicodin, Tramadol, Percocet, oxycodone, and many others. They're highly addictive substances that make your brain dependent on them. And what they do in your brain is that they shut off certain signals for pain. They come with a lot of different side effects, including diarrhea, nausea, withdrawals from opioids if you miss a dose or if you taper off too quickly, can be, in some cases, life-threatening, depending on what's going on with that. So why is massage therapy a potentially viable replacement for opioid medication? Like, what circumstances would that be? So I want to talk about that real quick. We have muscles in our bodies, and we have nerves, and we have blood, and we have all these other tissues, right? Well, pain is a signal to the brain. And some pains are just really distracting, and they hurt us a lot. So we want to make that pain go away. Taking a pill is very easy. For some people, taking pain medication is what they need to do on a daily basis. They just can't get relief from any other methods, whether it be stretching, yoga, swimming, physical therapy. They're always in pain. For those kinds of people, maybe massage therapy won't be beneficial, but for the kinds of people who have a musculoskeletal issue or an irritated nerve issue that is causing them pain, then manual therapy, or also known as massage therapy, may be of benefit. Let's look at something common. I want to go over something that's just kind of a common thing that I see a lot. SI joint pain. So you can't really see the bones on this guy, but what you can see is this is where the SI joint would be, and your sacrum sits there, and then here's your tailbone. When we have SI joint pain, the pain goes halfway down our butt usually, and sometimes our sciatic nerve gets caught up here, and we have pain all the way down the leg into the foot. In those cases, if you can identify the source of your pain, and you can get a proper diagnosis of where that pain is coming from, massage therapy may be of benefit to you. It may not be overnight, but it can be helpful to you. I had some pretty serious SI joint pain myself following a back sprain, or a re-aggravation of a back sprain that I had, and it was really bad. And my doctor said, well, you're doing physical therapy and you're doing all of these things, and the x-ray shows that you're fine. The next step would be narcotics. And I was like, no, I don't want narcotics. So I stuck with manual therapy. Now, the narcotics would have given me instantaneous relief, but with manual therapy, not only did I get my poor tailbone and my SI joints worked on, I got my pain to reduce in other areas as well. So massage therapy can be helpful for managing many different points of pain at once, and with consistent care, can keep your level of pain down, increase your flexibility, increase your mobility, and increase your overall sense of well-being while reducing stress levels, which I think is a big part of it. Okay, so then what was the second thing? Oh, the second thing was talking about massage therapy for long-term care pain. So if you're an individual who's had like a really serious injury, like I'll use myself as an example again. I had a really serious neck injury. It has taken me 2 years to finally understand what the fuck was wrong. Allopathic medicine failed me in that it could not diagnose what was really happening. I had to see a specialist, a manual therapist, who's also a massage therapist and a cranial sacral therapist, to get this diagnosed appropriately. And I won't go into great details. I can do that at another time. But what the allopathic doctors did get correct, and what was correct, was the rest of my medical team, which consists of physical therapy, physiatry, and massage therapy, was that I had whiplash. Regular massage actually hurt me a lot, but getting the right therapist, getting the right manual therapy, seeing the right specialist helped me tremendously over the last 2 years. And I dealt with like a lot of nerve pain and like chronic inflammation, like rebound inflammation. And I felt like I was a very fragile person because of what was happening. And so for me, I have to utilize manual therapy, physical therapy, and possibly physical medicine as a long-term care plan to manage my pain. An example that is not me is somebody who is an athlete, but they've had chronic injuries. And they want to stay in the game and they want to keep doing their sports. They get sore quicker, they get inflammation better, maybe their ankle just doesn't move quite right, or they have like a lot of knee pain, maybe they've had a previous surgery on their knee. Those individuals benefit from long-term physical therapy, manual therapy, also known as massage therapy, for managing their pain and increasing their mobility, range of motion, and giving them an overall sense of well-being. I don't think that all of your pain can be cured through manual therapy, but I think that we can reduce it down to a manageable level. And I think in some cases, switching off of opioids to regular manual therapy, if you're able to, can give you longer term benefits and get you more in touch with yourself and get you more of a sense of being grounded, higher sense of well-being, than if you were to just pop a pill every day in hopes of like getting it better. And it's good for helping you manage your lifestyle and get interested in being more active if you are able to. Massage therapy, manual therapy, is also very good for palliative care. If you're somebody who's like older or you're very chronically ill, terminally ill, manual therapy can do wonders in improving your quality of life, your overall sense of well-being. And that's what I'm here for. I'm a painkiller, but I do that through touch, through informed touch. I do that through taking classes, lots and lots of classes. I have a good understanding of anatomy, physiology, kinesiology, neurology, and I have a good understanding of how our emotional and mental state affects pain in our body as well. So I hope you found this informative, and if you have any questions, please leave them in the comments, and I'd be happy to either make a video to answer that question or type right back at you. So thanks for sticking with me.